A visible sign of optimism at one Santa Clara County hospital is what you don't see anymore. The surge tents at Good Samaritan in San Jose have come down. KPIX5's Devin Fehely there now tells us there's more encouraging news coming from inside the hospital. Devin?
Yeah, that's exactly right. For the last 6 weeks, hospitals and public health officials have been bracing for a worst-case scenario in which a surge of patients would just overwhelm the capacity of the system. Too many patients and too few rooms, equipment, and staff to serve them. But there is some evidence that the worst may be behind us. A month ago, doctors and nurses at San Jose's Good Samaritan Hospital were treating roughly 50 new coronavirus patients a day in 2 temporary tents set up outside the hospital's ER.
We brought out these tents so that we could have a surge capacity for COVID-19 patients that was in a safe environment to make sure that our patients that were in the emergency department that were non-COVID related were able to be in an environment that weren't exposed to those patients.
Mark Brown, Good Sam's chief nursing officer, says the hospital began to see the number of new patients seeking treatment and testing decline a few weeks after the shelter-in-place order was first issued. The number's now low enough that the tents have been packed up and stored away. And inside the hospital, where at the height of the outbreak 3 entire floors were dedicated exclusively to coronavirus patients, things have changed as well.
At the height of it, that was 3 entire nursing departments that were dedicated to treating COVID-19 patients. Now we're down to just 1.
Across town at Regional Medical Center, owned by the same parent company as Good Sam, the news is not as good. They've seen a slight decline, but not enough to get rid of the tents just yet. The hospital released a statement saying, "We remain busy combating the virus, but are pleased to see a slight decline in our numbers to date, as we see in the county. For now, the tents remain. A reminder that progress has been patchwork and recovery far from complete." Now, the hospitals say social distancing does in fact work, but they're a bit nervous about what comes next as a county, a region, and a state, because they say if you get it wrong, you could once again see a spike in cases. In San Jose, Devin Fehely, KPIX5.